Well, there's another kind of shortage affecting urgent care facilities in Oklahoma. A shortage of qualified staff is resulting in cutbacks and closures. Reporter Sweeney has been covering this development for our content partner, StateImpact Oklahoma. I spoke with her earlier about the staffing shortages with the busy flu season just about to ramp up. Catherine, let's begin with a simple definition of urgent care facilities. How would they differ, say, from hospitals or emergency rooms?
When you go to the emergency room, it's pretty serious, right? You have a really bad accident or something very terrible happens. Urgent care is kind of between a doctor's office and the emergency room. So you break your finger. You don't want to wait until Monday to get into your doctor for that, but you don't necessarily need to go to the emergency room.
So what are the primary reasons for the staffing shortages? What types of workers are they looking for?
All of Oklahoma and really the whole country is having all kinds of shortages of medical workers, doctors, nurses, and urgent cares aren't immune from that. But one of the things that they really rely on is called a medical assistant. It's a little bit of a step above a certified nursing assistant or a CNA. They could take your vitals and do some basic medical services in addition to some of the front of the house reception services. And because urgent care is a little less acute than an emergency room, they rely on those. Well, as the nursing shortage has gotten worse, a lot of other medical facilities are starting to recruit those medical assistants away. And so now urgent cares are facing competition for medical assistants that they haven't before. And before the pandemic, I mean, there was already a shortage of them coming out of school, and now it's more competitive to get them, so it's just really compounded.
I mentioned the flu season earlier. Is that going to make this problem even worse?
That is very true. So one of the things that they will always tell you in public health, urgent care, any of these outside of the ER is that flu season is like the Super Bowl for these people. It is the busiest time outside of the pandemic, obviously. And so they're saying, okay, we already have this new baseline from the pandemic and it's about to be flu season again. So there's definitely going to be some strain.
Is COVID testing or people being asked to be tested, is that having an impact on these workers?
That's having a huge impact. You remember when testing first hit the scene, urgent cares were some of the only places to get them. Before the counties had their sites set up that were huge and before these big drive-through testing facilities, urgent cares were the place to go. And that has maintained its pace through most of the pandemic. And as you remember, just this late summer, early fall, we had that awful surge. And one of the urgent cares I talked with said that they were having, 400 tests a month, 400 tests a month, and then it hit 1,000 for August and September. It just was huge. And that was because this demand just skyrocketed.
Catherine, our COVID numbers are decreasing. Certainly we hope that continues. Is that going to give these urgent cares a chance to kind of step back and catch their breath?
For sure. So there's kind of a two-ply problem with when the pandemic is raging for these urgent cares. One, there is a big demand on testing for them, but also there are urgent cares that are part of hospital systems. Mercy has urgent cares, Saints, and whenever things are busy in the urgent care but not necessarily in the hospital, they could say, hey, oncology, can you send somebody over to urgent care? Hey, pulmonology, can you send somebody? But when the hospitals are full to the gills, you can't send anybody from the hospital over. So getting lower hospitalizations, lower COVID numbers will help these urgent cares.
As always, great reporting. Catherine Sweeney, StateImpact Oklahoma, thank you.
Thank you for having me.